Hi friends, today our topic is the breast cancer. So what is breast cancer? Breast cancer is the uncontrolled growth of breast cells that is in abnormal in nature. The breast cancer is the malignant tumor. The tumor are uh, classified in the two types, that are the malignant and the benign. Benign tumors are the one which do not spread to the other parts of the body, and the malignant one can spread to the other parts of the body, that are the lymph nodes which are surrounding to the breast, which occurs anywhere in the breast. The cancer can occur anywhere in the breast, but it mostly occurs in the upper outer quadrant of the breast. Upper outer quadrant, there are many cell mass, so it usually occurs there. They either Breast cancer either occurs in the lobules. The lobules are the glands which produces milk in the breast. So these are the glands. Lobules are the glands which produces milk in the breast, or the ducts. So here I have drawn the diagram of the breast when there is the tumor or the abnormal cell mass takes place. So we will consider in the lobules, that means in the glands which produce milk, there is an abnormal proliferation of the breast cells. So this is the abnormal proliferation of the breast cell. So it eventually turns into the tumor, and these are malignant in nature, so it spread to the other parts of the body, such as lymph nodes and other things. So it spread to the blood vessels, to the other parts of the body. So this is the diagram of the breast. Here now we will focus on the forms of the CA breast. The first one is the invasive ductal carcinoma. It is of 79% in the cases the invasive ductal carcinoma has been seen. So this type of breast cancer develop in the male ducts. The second one is the invasive lobular carcinoma, which originates in the breast milk producing lobules. They are in the 10% cases. The third one is the medullary mucinous carcinoma. It is of slow growing types, means the growth of this carcinoma is slow and it occurs in the 1% of the cases. The fourth one is the Paget's disease. It starts in the male ducts and it can spread to the areola above the nipple. There is the dark color ring present, so it can spread to the areola also, and it occurs in the 1%. The inflammatory carcinoma has the most aggressive, and it is the difficult to treat, and it spreads rapidly, and it is of 1% in the cases. The ductal carcinoma in situ, or DCIS, occurs when cancer cells fill the ducts but haven't yet spread to the walls into the fatty tissue. The seventh one is the lobular carcinoma in situ. It is of less common type, and it develops in the milk producing lobules and doesn't require treatment, but it also increases the woman's risk of breast cancer. So these are the forms of the breast cancer. Here we will now focus on the risk factors of the breast cancer. The exact cause of the breast cancer is unknown. The exact cause is unknown. But it is seen in most women over the age of 62. So the age of the woman above 62 years may develop the breast cancer. If the patient or the woman has having the personal history of breast cancer, means the woman is having breast cancer earlier, so it also increases the risk of breast cancer. Uh, so if any patient or the any woman is having the family history of breast cancer, so she may develop the breast cancer. Means in her family, if anyone is having breast cancer, so there is a chances that she can also have the breast cancer. So the certain breast changes in the breast can trigger the breast cancer. Gene changes. Now we will focus on the genes. Gene changes. The genes such as the BRCA, BRCA1 and BRCA2. If there is the possibility of genes in the woman of BRCA1 and BRCA2, so she may develop the breast cancer. The other are also there. First menstrual period, before the age of 12, may develop the breast cancer, and the menopause after age of 55 in woman. Menopause after the age of 55 years, um, so the woman is prone to get the breast cancer. uh, we will focus on now the other more risk factors. So the woman who has already having the different cancer, but if there is a radiation or the radiation therapy given to the chest area, so she may develop the breast cancer. The hormonal replacement therapy, if any woman has taken the hormonal replacement therapy, may have chances to develop the breast cancer. The use of oral contraceptives may trigger this disease. The woman who has gained a lot of weight after the menopause, may prone to get the breast cancer. So the lack of physical activity and the alcohol drinking may trigger to the uh, risk for the breast cancer. So these are some risk factors for the breast cancers. Here now we will focus on the clinical manifestation or the signs and symptoms of the breast cancer. According to the American Cancer Society, any lump or thickening in or near the breast is a sign of breast cancer. Change in the size or shape of the breast, change in the shape or the size of the breast. The skin near the areola, nipple or the breast becomes the scaly, red and swollen. So this is also the sign of the breast cancer. The skin irritation, the breast skin becomes irritable. There is also the breast pain because of the tumor. There is also the nipple pain. The seventh sign is the nipple turn inward into the base, means nipple becomes goes into the breast, and there is an discharge, means any other discharge other than the breast milk may be the cause of the breast cancer. So these are the clinical manifestations of the breast cancer. Here now we will focus on the diagnostic evaluations of the breast cancer. So the first one is the mammogram. This is the imaging test is done. USG, that is an ultrasound. The MRI, third one is the MRI test is done. Biopsy, In biopsy, a small part of the tumor or the breast is taken during the surgery and sent for the test outside. So there we can conclude that the tumor is the malignant or the benign type. The fifth one is the CT scan, and the sixth one is the bone scan. So these are the diagnostic evaluations of the breast cancer. Here now we will focus on the management part of the breast cancer. So the first one is the surgery. In surgery, the mastectomy is done. The mastectomy is done to remove the part of the breast or the overall removal of the breast where the cancer has spread. Lymph node dissection. The lymph node dissection, in this the lymph nodes are removed because the cancer has spread to the lymph nodes. So to stop the spreading of cancer to the breast, it has been removed. It is used to be removed. So the prophylactic ovary removal. So it is a preventive surgery where the ovaries are removed. So the estrogen does not uh, uh, produce the hormones for the development of the breast cancer. So the B is the radiation therapy. In radiation therapy, there are two types: the external radiation and the internal radiation. In external type of radiation, the large machine gives the radiation to the affected part where the cancer has spread, and in internal radiation, the long invasive uh, needles are inserted into the breast and the radiations are spread. The C is the chemotherapy. In chemotherapy, the IV drugs or the oral medications are given to the patient, and the last one is the hormone therapy. Thank you guys, hope you like this video.